Go on.
Yes. Hello, good morning, good afternoon, good evening. I'm Jessie Brand, Manager of Operations and Development for the Global Wellness Summit and Institute. Please introduce yourself in the chat. If you haven't, let us know where you're joining us from. Some quick logistics, feel free to choose between gallery or speaker view. Please keep yourself on mute when you're not speaking, and I will be muting everyone now. Yes. Wonderful. Let me share my screen. Can you see my presentation? I'm having some Zoom issues today here.
Good. You're good.
Welcome to our December full moon celebration. Thank you for joining us today to bring our Wellness Moonshot mission to life. As you might already know, the term moonshot originally came from President John F. Kennedy's mission to land a man on the moon in the 1960s. Our equally ambitious goal is to create a world free of preventable disease. The Global Wellness Institute brings together many thought leaders and wellness pioneers that help us drive and shape this mission and the future of wellness. You might recognize some familiar faces here in this picture. This was the photo from the launch of the Wellness Moonshot in 2017. Because expanding our reach is a top priority, we track our Moonshot metrics closely. In the past month, we've grown by 162 individuals and organizations, impacting over 25,342 new people. I now have the pleasure of introducing you to our host, Nancy Davis, our Chief Creative Officer and Executive Director. Nancy, over to you.
Thank you, Jessie, and welcome everyone. The total numbers, by the way, the Moonshot is over 160 million people impacted, which is really, really incredible. And, you know, when I look at that photo of the launch of the Wellness Moonshot, I'm amazed that it's been 5 years, but sometimes it feels like yesterday. And I think that's because this project has been so alive in our collective consciousness with the information we gather and send, the incredible interviews Renee Moorfield conducts as part of this project, these full moon celebration calls, the beautiful calendars that Jessica has designed, and the increased awareness about prevention throughout the world. The theme this month on that beautiful calendar is thank. And we are going to embrace that theme as we express gratitude to those who have brought the Wellness Moonshot to this moment and to those poised to take it into the next phase. Then we're going to ask all of you for some very important input. First, Susie Ellis, Chair and CEO of the Global Wellness Institute and a guiding light for the Wellness Moonshot. Susie was the spark that lit the flame that became the Wellness Moonshot, and we have all benefited from her wisdom and guidance as we developed this important focus on prevention. Susie, would you like to say a few words?
Thank you, Nancy, and welcome everyone. And I would like to say the spark was really when Rich Carmona and I talked about what we could all get behind, that the medical world, the wellness world, everyone can get behind, and that's where the Wellness Moonshot came from. And I just wanted to say this morning that I was listening to a podcast about moonshots, actually. And one of the things they were talking about, and I think it applies today, is that sometimes the timing is, you know, well, it's always very important, but 5 years ago, we introduced the Wellness Moonshot, but the timing feels like now is the time when more people understand it and can be part of it. So a world free of preventable disease is something more people 5 years later understand and can get behind than 5 years ago.
Thank you, Susie. And next up, I do want to thank Rich Carmona. Many of you know Rich, 17th U.S. Surgeon General and Chief of Health Innovations for Canyon Ranch. Rich has been at the forefront of the global conversation about prevention for a long, long time and has led the Wellness Moonshot effort since its inception. Rich, a few thoughts from you?
Nancy, I thank you for your kind words, but this is really about a team that Susie and you and everybody brought together globally. I mean, we even have our own flight surgeon. I see my good friend Smith Johnson there, you know, so talk about moonshots. Couldn't have better medical support for that. But really, it's been a team effort, and it grew from a late night phone call between Susie and I trying to figure out, and that's really Susie driving this, how to do something that'll bring us together globally, a common value proposition. And here we are 5 years later, where it's really a central theme as part of all of our global wellness activities. So I'm just happy and proud to be part of the team, and I look forward to continuing on this journey.
Rich, thank you so much, and for all you do with the Moonshot and with everything else in your world. Next up, Jessica Jesse. She is the CEO, founder, and creative director of Buddha Girl, a company redefining the path to well-being by combining contemplative practice, science, and wait for it, fashion. Jessica knew that if she transformed the concept of the Wellness Moonshot into something beautiful, tangible, and accessible, people would embrace it. And she created the first Wellness Moonshot calendar in 2019, and we have benefited from Jessica's talents and wisdom throughout the development and deployment of this project. Jessica, I know you are on. Thank you. You had a meeting, but you made yourself available. I wonder if you could share a thought about this project and what it means to you.
Good morning, everybody. And it's lovely to see the group together. And I'm just so proud of the work you guys have done, Susie. I mean, when I hear the millions, that million word, it just kind of gives me goosebumps, you know, and I just am so happy that you keep inviting me back. And it's really a privilege to try and help people, you know, understand that we can fight chronic disease and preventable disease. And I hope to, you know, be invited back. Thank you so much.
Oh, Jessica, you can consider that a lock. We always want you to be part of this, and your vision of creating a way for people to access this project and to make it beautiful is something that we're going to want to carry forward. And I'm very excited for you to be part of the team that takes this forward with our new partners, who I will introduce in just a moment. So, but thanks so much for being on the call. Renee Moorfield, who's the CEO of Wisdom Works, could not be on the call today. She's at the Modern Elder Academy with Chip Conley, but she's been instrumental in writing the monthly newsletters that everybody receives and helping to shape the content that drives the project. Lisa Fizzulo, I'm assuming you are on the call now. Lisa Fizzulo is founder and director of Transformative Movement. And Lisa creates innovative evidence-based movement, meditation experiences, and products. But to us, Lisa is the woman who helps us all end these calls on a joyous note, dancing together in celebration of the full moon and the fullness of life. Lisa, if you're on the call, would you unmute and just give us one quick thought about the Moonshot?
Yes, hello, Nancy. Thank you so much. Today, excuse me, at the end, we're going to be turning up our inner factories that can create thank you, that can create so many things. And when we emit thank yous, it is like the feel-good factory is just emitting, we're feeling it, everyone's feeling it. So I look forward to sharing that with everyone.
Thank you, Lisa. We look forward to dancing later. Jesse Brandt, who you met, who started off the call, manager of operations and development, and the person who keeps this Moonshot train running on time and on track, who works hard to ensure we all have a good experience when we gather together for these calls and throughout the year. Jesse, a thought. I think you walked your dog and in very, very early and under the full moon today.
Yes, it was 6 o'clock in the morning. I enjoyed the full moon in Loveland, Colorado. Was so inspired. I'm very excited to see so many of you, and you will all receive a follow-up email. There were questions in the chat. We will share the recording, all resources that will be mentioned, and I'm very excited for the next year. So thank you, Nancy.
Thank you, Jessie, for all you do. Now it's my pleasure to introduce some of the team that will, in partnership with the Institute leadership and all of you, take this project forward into the next phase. At the summit in Tel Aviv, we announced a formal partnership with Fountain Life, a company dedicated to putting the individual in control of their health by providing full transparency of all kinds of biometric data, custom care plans, a complete ownership of well-being. Their tagline is "Be the CEO of your health," and we could not agree more. It is this alignment of goals and principles that underpins our partnership for 2023. In the coming weeks, we will be outlining the plans for the Wellness Moonshot for the coming year. But I want you to meet some of the Fountain Life team and to get your thoughts on what would be important and beneficial for this project. Sean Buckheit is the COO of Fountain Life. He's an internationally renowned thought leader with decades of experience in designing transformative businesses, client strategies. He's worked for major brands in well-being, preventative medicine, and fitness sectors and helped build them all. In his position as a health and wellness influencer, his work has really helped shift industry trends and values. And as COO of Fountain Life and Fountain Life Health Insurance, Sean leads highly impactful business development initiatives, and he's been an absolute pleasure to work with on this partnership already. We're very excited. He was in Tel Aviv with us. Sean, would you unmute and give us some thoughts about our partnership and what you're seeing for the Moonshot ahead?
Yeah, no, thank you, Nancy. Thank you, Susie. Really appreciate the opportunity to bring our organization to contribute to this this Moonshot. We're very passionate about early detection, prevention, empowerment of your own health, as you said, CEO of your own health. We often talk about in Fountain Life the importance of convergence. And for me, when I look on this call, yourself and Susie and Rich and Smith Johnson, who we're very familiar with as well. I just see the very picture of that, and really to promote the type of thought leadership and action and change. This is what I've learned through my last 2 years at Fountain Life is what's so impactful. So I'm very pleased to bring in really an additional part, I think, of the world, whether it's traditional like Dr. Surrey, Bill Kapp, and all these amazing resources to bring them into this pool and help participate in this just amazing Moonshot that you've launched. So I really think timing is everything. Peter often talks about, Peter Diamandis, or what's your massive transformational purpose. So we're always trying to focus on moonshots and things like this. And I just really cannot wait to engage each and every one of you and participate. And I couldn't be more excited. So thank you, Nancy. Thank you, Susie, for just, developing this incredible platform to facilitate this. Thank you so much.
Sean, thank you. Why don't you talk a little bit about the founders and some of the people involved in this? Because I think if not everybody knows, it's really very powerful and impressive, and it has a lot of potential, I think, for this project.
Yeah, sure. So the original founders of the organization were four gentlemen. One is Dr. Bob Harari, discovered the placental stem cell with cellularity. Amazing individual, neurosurgeon. Dr. Bill Kapp, who is our CEO, orthopedic surgeon, founder, and built 10 landmark hospitals. An amazing, I would say, one of the most amazing individuals as far as promoting, convergence and bringing myself in, for instance, into the organization would be one example of that. And then we have many of you know Tony Robbins, one of the original founders. He's actively involved in the company each and every day, each and every week. And then finally, just spent a 2-day leadership retreat in LA here with Dr. Peter Diamandis. So for you, those of you that don't know, Peter, he has some amazing books, and they're all relevant. The Future is Faster Than You Think. And, really just an amazing thought leader individual, and just so pleased. And then, I'll mention, we brought on, we're always interested in bringing in, really to support this, because a lot of the things that we're trying to accomplish is not easy. We say change, sick care, or, change healthcare from sick care to, healthcare. We just brought on as our president and chief medical officer, Dr. Rakesh Suri, he's a heart surgeon, by trade, former CEO of the Cleveland Clinic, Abu Dhabi. So just some amazing, talented, individuals. We're only 2 years old as a company, and it's really hard to believe that, because we've done so much. But I couldn't be prouder to be part of the company, this organization. If I could just say one thing, more to, I think how we're positioned well to support this is, I'm from a hospitality background, and wellness and Ritz-Carlton is my background. And I'm extremely humbled, and it's quite the responsibility to have such amazing leaders, and then for them to select you as the chief operating officer. So again, I think that's a credit to kind of the convergence and what's happening in the industry with hospitality. I really believe the future of hospitality is in medicine, and that convergence. So, thank you, Nancy, and I really appreciate it.
Okay, that's quite a soundbite. The future of hospitality is in medicine.
I believe it. I do.
Okay.
Yeah.
That's an incredible thought, and something that we'll take forward. I think everybody, you can start to see where this Moonshot can go with this kind of partnership, which is very, very exciting. Sean, thank you so much, and we'll come back to you later. Evan Balter, who's the director of marketing for Fountain Life and a very good colleague already and friend. He is a seasoned marketing professional, very strategic, has helped to build businesses in health, wellness in the medical space. He is really good at guiding strategies from conception to completion, execution being very, very important for us. And we're very excited to work with him for growing this and expanding the reach of the Moonshot. Evan, what thoughts would you like to share with us?
Yeah, so I like to take what Dr. Bill Kapp, our CEO, talks about. He's a pilot in his history. And if we treated medicine like we do airlines, we'd be in much better shape. So we don't wait until the wheel falls off the airplane before we start to try to fix it or diagnose what's going on. And that's the same thing with our health. So the car industry, plane industry, it's all the same. They have sensors that are finding out and diagnosing things before something catastrophic happens. So we can do the same thing with health. 7 of the top 10 killers in the United States are preventable disease. So 70% of the people that die of cancers die from cancers that are not regularly screened for. 70% of people that die of heart attacks have no symptoms before they have the heart attack. So we're only treating the people that are symptomatic instead of looking for things before you're symptomatic. If we just go off the symptoms, a lot of times it's too late. So I think it's a big part of this is changing the mindset, changing how medicine and the healthcare industry work, to stop waiting for the symptoms to occur and use the new technologies that are available today and the AI as a tool to help physicians, not replace anything, but it's used as a tool to help identify soft plaque, hard plaque, inflammation in the brain and in the arteries. And that will help us change healthcare and find things so early that we can eradicate them or mitigate it from getting any worse. So I really like Dr. Kapp's plane. The engine fell off, everyone would be panicking, but
Yes.
that never happens because of all the preventative care they do.
It's a great analogy, Evan. Thank you. And Dr. Kapp, the Fountain Life team was with us in Tel Aviv at the summit. They are as impressive everywhere as they sound on this call as they are. And we're so excited because this is really a chance for us to take the Moonshot. And this is something a lot of people have asked for, to take the Moonshot into actionable steps to really give people tools that can impact behavior change. And I think that that's really the next phase of this. And with partners like Fountain Life, it is going to happen. I know there are other members of the Fountain Life team on this call, and I saw a bunch of them sign up, including my friend, Dr. Shapiro, but I don't know if he's on the call, but I know there are a couple of others. If you would unmute and introduce yourself, I just like everybody, these are our Moonshot tribe who come to our calls and are really involved. I'd like them to meet you. So Kimberly, Patricia, will you unmute and just introduce yourselves?
Absolutely. Kimberly, go ahead.
Hi, good morning, everyone. It's a pleasure to be here. We're just in the day-to-day operations with Fountain Life, helping to educate people about the opportunities that we offer and hoping to help save as many lives as we possibly can with this amazing technology that is available, and trying to spread the word and get more people involved so that we're able to change healthcare from reactive to proactive. And hopefully part of this crusade will pay off in the future unbelievably well.
Thank you, Kimberly. I love the word crusade. Patricia?
Hi, everybody. Thank you for the opportunity. Sean, thanks for being a great leader. It takes when we're little kids, it takes a father and a mother to raise up and to be the person who we will become. And in our work, we spend 8 hours, so we become family, and our leaders become that guidance. And if we weren't those guides, we wouldn't be happy. So we touch people every day. We speak with people every day, and we're happy about it. And that's definitely changing. Touching other people's life, changing other people's life is incredible. So that makes us happy too. So thanks for the leaders.
Thank you. Thanks, Patricia. Is there anyone else from Fountain Life on the call? I can't see every screen at the same time. If you are, please just unmute and say hello.
That's the group.
We have
the
a full
group,
conference
group.
room.
Yes.
Fountain Life people.
Oh, okay, we've got a Fountain Life conference room. Okay, who's in that?
Fountain Zoom.
It may be, Nancy, it might be a little bit of a big group to introduce. I know
Okay.
we don't have a lot of time.
Yeah.
All right.
Just wave.
Just wave hello,
Yes,
Fountain
yes,
room.
there. Yes.
Wonderful.
Thank you. Thank you so much. That's
You're
wonderful.
all the expert at the Whole Brain Foundation.
Sean, I wonder if you could just talk for 1 minute about the Fountain Life Insurance, that whole part of the business, because I think there is a tremendous opportunity for reach for the Moonshot.
Yeah, we're thank you for that opportunity, Nancy. So, one of the, even from the very, outset, one of the important drivers for this was to democratize, demonetize, the services that we deliver. Tony was very clear, his goal is for everybody to have access to the tools and resources that he has in his basement. And because he has a lot of this in his basement. So, when you really think how are you going to do that? Because, some of these, treatments and services are quite expensive. So, going back to, how could, so we started to, kind of group think and about, how we would do that. And really that led to Fountain Life and what Fountain Life, our Fountain Health Insurance is it's your coverage. So typically what we do is, we call it the sick care and the healthcare part of the coverage. So the traditional sick care part of the coverage, copay, deductibles, same doctors. Really, we try to alleviate that because you do have to get past that hurdle. What happens if you get sick? So we roadmap it, we match it. But the unique thing we do for no additional cost, a health benefit, is that we add 4 preventative screenings, fully covered wellness benefits throughout the year. For instance, I'll give you one of them: Grail cancer screening. If you were to go pay for it, with cash, it's about $1,000. We offer that to every single employee as a fully covered health benefit. So again, if you think about, even in our service commitment, when we support, mixed use developments, hospitality, it's a lot of it are private club market, country clubs. We're always talking about, when we're, health and wellness, really about the people that live there or visit there. And really, the number one thing that experience is dependent on is the employees that serve them or facilitate that journey. So let's not leave them out. We can share with the Fountain Life, the members can come into the facility, but we can also support the entire ecosystem through Fountain Health Insurance. And we're having tremendous success, in bringing on early adopters like Spartan Racing, working very strongly with Invited Clubs, and David Pillsbury is the CEO. So really great traction. And I would love to provide anybody, on this call information about Fountain Health Insurance. It's a really, really powerful tool.
Yeah, that I think is a really important. I mean, Fountain Life, you have it just explained for a minute that you have freestanding facilities. And I think you're growing those and expanding all over, but the insurance has the ability to really be anywhere. Is that correct? Am I saying that?
You are. It's global, truly. We have 4 what we call our brick and mortar locations currently. We have Naples, Florida. We have Westchester, New York. We just opened in Dallas, Texas, in a mixed-use development called Grandscape, Frisco, north of Dallas there. That's a 14,000 square foot, beautiful facility. And then we have Orlando, or Lake Nona, is opening January 30th. So that's so there's the theme here is, and why I think we're positioned so well is, moving forward, we only consider going into mixed-use developments, live, work, play communities. It's really because when you think about what we do is a membership-based program, we're supporting with the developer from the outset, curating from the conception of the development, and bringing in and attracting best-in-class tenants. So we all know medical tourism, we talk about at 1.6 trillion, if I'm remembered, by 2025. And thank you for all the reports you do, Nancy and Steve. I really appreciate that. It helps me every day. But, mixed use, multifamily, mixed use, multi-tenant office space. So we're really facilitating, how do we integrate from, really not a sick care. I think it's not necessarily a new concept, but I think maybe in my experience, one of the reasons why the integrations haven't worked in the past is because they've been supported, not completely. There's the outliers that have done really well, but in general, you see hospital systems come in and really, from a what we call, sick care. We all need it, but more of a early detection, prevention that facilitates the complete wellness journey, that I think many of us are looking for.
And Sean, are you that we know a lot of the people on this call, you'll get to know them over the over 2023 and beyond. A lot of them are leaders in hospitality, in travel and tourism all over the world. It's a very global group. And I'm sure plenty of them are wondering whether or not you have an interest in being part of, in terms of mixed use, like hospitality destinations, because there's such a convergence of medical and wellness that we're seeing. I'm sure everyone is. Is that an objective for what you're doing?
It is. I can outline some of the conversation we're supporting. Obviously, we signed a letter of intent with the Blue Zone Center there in Miami. A lot of synergies there, but I'm actually going to be with our good friend Alfredo Carvajal today in Rancho Porto.
Send him our love.
I will. Really exciting conversations, not just in Rancho La Porta, but in some development in Mexico. We have a mixed-use facility. We're in a letter of intent in downtown LA with the Los Angeles Center Studios. It's amazing. They'll have 2 5-star hotels. They have the movie studios. It's really a one-of-a-kind mixed-use development. There's a and Rich may know, I travel tomorrow to Tucson. I meet with a really forward-thinking, tremendous development company called Bourne Development, Don Bourne. He has a new development called Urban down there. And that's just, the Mayflower and Park City, Aspen Club. So we have no fewer than probably 20 active conversations supporting mixed-use developments, this very thing. And it's accelerating at a level where we really have to, we're looking to build out our team even more. So, if anybody has any good candidates that we might want to consider, please send our way. We appreciate that.
One of the things we will certainly do, not to explode your already exploding inbox, is we will share contact information to this, from this call to all of you, because I think there are some people very interested. I only can catch out of the corner of my eye the active chat going on, but we do capture the chat as well as the call, and we share all of that, but we will certainly give, the information for people to contact Fountain Life to carry the conversation forward. So thank you for that. Now it's time. First, I want to thank all of you who have been supporting this project, shown up on these calls, read the newsletters, bought the calendars. You've played a very important role in the forward motion of this Wellness Moonshot. So I thank you all. I know Susie thanks you. We really appreciate everything you have done by showing up, which is really the main thing. So the question now, and this question is for all of you. As we look at 2023 and this extraordinary partnership, which you're just learning about, what is the one thing that you think the Wellness Moonshot could do that would be beneficial in helping people make positive change in their behaviors and their lives? And if you raise your virtual hand, and you can do that in Zoom if you just go to reactions at the bottom of your Zoom window, there's a raise a hand. I'll call on you. And when you do, when I call on you, unmute yourself, just say your name and your country and contribute in under a minute, just your idea. Don't tell us about everything that you do. We will find that out. But we'd like to know what idea, how can we help really move the needle now? I think Susie is right. This is the time. This is the moment. This is the partnership. This is the way to take this forward, and we're all interested. And I will also say, if you have a question for Sean or Dr. Carmona or somebody, that's okay too, but make it really, really brief so we can get to as many of you as possible and really get your thoughts and feelings. John McHugh, please unmute.
Sure, I just was looking, I'm a physician, I looked up the GRAIL test as it was being discussed. I wasn't very well aware of it, but I think something like that could really help motivate people to make behavior change to prevent future cancers.
Okay, that is excellent. Excellent. And if you do that through Fountain Health, the insurance part, I guess it's whether or not other companies and other insurers will decide to do things like that. Sean, is that something you're seeing in other companies, or is that very unique to Fountain Life?
Oh, it's accelerating. Fountain Health was the first insurance company to offer GRAIL, and we do coronary CT angiograms with clearly. We do other scans as well and stuff, but it's super important because as Evan mentioned earlier, the human body is very good at masking disease. And often by the time that you see it, if you're not scanning for it, it could be too late. So 17.7% of the people that come through what we call our precision diagnostics, has something that requires to be medically addressed right away. So
can you tell us in very quickly what a GRAIL test is? I mean, what does it involve?
Yeah, so it's a blood draw, single vial blood draw, 50 forms of cancer from a single,
Wow.
GRAIL. Yeah, so it's very powerful. I believe there's, Dr. Cap, but he may correct me, but I believe until GRAIL there's 5 cancers we screen for regularly or have a screening. So you can imagine 50. It's been very impactful.
Okay, terrific. Next up with her hand raised, what the doctor recommends.
Hi there. Sorry, I should have put my name. I'm Dr. Noreen Nguru from the UK. You can probably hear from my accent. So hi, everyone. So I only just joined the Global sort of Wellness Institute a week ago. So I'm really fascinated with everything I'm hearing. Thank you. Amy just welcomed me. So I think one thing that or a couple of things that we really need to do is education in simpler terms. And it's just about making this medical information that's out there about these intersections of wellness and tourism and medical tourism and mental health and medicine makes sense to the audience. Sometimes it feels like we're in an echo chamber and we use all this medical speak and it's not filtering down in campaigns. And I feel like there needs to be more of a coordinated social media campaign or something that helps to get the message out there, because I know in the UK, pretty much all the millennial physicians are moving towards preventative medicine lifestyle measures to really further this, our agenda to make the public have this collaborative approach to taking care of their health, going
So,
back to
so
things
it's
like
it's
more.
simplified education, make it accessible and make it and far reaching, maybe use social media.
I think so. And also in terms of that intersection of, so I'm actually the founder of the world's first.
I need to move on to
Oh,
subject.
carry
We
on.
need to
Yeah,
keep this.
but yeah, no, I think this is utterly fascinating. But that
Okay, and
kind of
just because
social
you're
media.
new to this, that is really a goal of the Moonshot, you should know, is to make this information accessible and easy to communicate. Rich, I know you're shaking your head. You want to just comment on that for a minute?
Yeah, I'm sure. Thanks, Nancy. When we first started, one of the first pillars of what we were doing was to make sure that all of our communications are health literate, culturally competent, in order to effect sustainable behavioral change.
Right. Thank you. And we will continue to do that, and we'll hone in even better. And Heidi Moon's on the call. She's our marketing strategist, and she's got all kinds of ideas for social media and campaigns for this. So it's very exciting. Bruce.
Good morning, Bruce Wayne from Austin, Texas. And my comment is about mental health. It seems to me that a lot of diseases really begin with a disorientation of mental well-being. And how does the Moonshot address those types of issues?
Thank you. Who would like to respond to that? Mental wellness, Rich, you're still unmuted, is a huge part of what we do. Go ahead, Rich.
Yes, from the very beginning, as we looked at the diversity of the challenges that constituted the preventable disease and economic burden in the world, we recognized that mental health was one as well. We've had some early conversations with the National Institutes of Mental Health and some of our colleagues there as to how to better reach out, and using lots of the platforms we have, media and so on. It's a very complex issue because of language and cultural barriers, but nevertheless, we recognize it is a significant problem that we were willing to take on as part of this endeavor.
Yeah, my thought is that mental health is lagging behind a lot of these other things in terms of physiology, exercise, nutrition, functional medicine, these types of lifestyle things. But mental health is in the dark ages in a lot of ways. So yes. I'm glad you're addressing it.
We definitely are. And Sean, in mental wellness, mental health being part of Fountain Life's goals.
Yeah, we have part of being in the mixed use development space is it really facilitates great collaboration. So we get to work with great partners like Deepak and the Chopra Learning Center there in Lake Nona. So we actually have some close collaboration with that. Mind body super important, but it is I agree with all the comments here. Even within our offering and focus, it's one that needs to decrease. And I think anybody that has had a loved one or a family member or friend suffer from mental illness will agree. It's not only one of the biggest opportunities, but it's also one of the most debilitating, I think, things that we can have or witness. So a big focus and
Great.
Have increasing focus on that.
Great. That is absolutely a focus, and certainly of the work we do at the Institute. Charles.
I'm Charlie Atkinson, a doctor of education from Harvard in Cambridge, Massachusetts. I'm about to be 87 on Monday. I am launching, along with your Moonshot project, I'm launching the Moonshot project to put a new mind on every person in the world.
That's fabulous.
And the idea for the Moonshot project is to come up with a conceptual framework with a visual representation architecture that gives you a way of seeing the mind. I filed a patent in 2020. Been working with Mass General Brigham, and in 2019 and 2020, we renamed the application to healthcare the whole connected health system, realizing that we're in an ecosystem where there are so many dimensions and so many parts that have to be connected that connecting one or two or three is just a fraction of the problem. what we're focusing on now.
I'm sorry, I'm gonna interrupt you. What you're doing sounds incredible. And is it your thought that what you're doing with the mind might in some way dovetail with the work that we're doing? We could reach out to you?
Yes, I'd like you to reach out to me, and I'll be able to send you next week a executive summary that we can send to everybody to see who might want to be interested.
Terrific. That is incredible. And I know Jesse is not only recording this and taking notes and looking at the chat, but you're now in our tribe. So, and happy early birthday.
Thank you, Nancy.
Sandy Abrams, our dear friend who teaches us how to breathe. What's your contribution to this? And we're going to do a little bit faster, everyone, so a lot of hands are up.
Okay, super quick. I just wanted to echo what Susie mentioned about timing. It is the perfect timing with prevention, because what I'm seeing in my breath workshops is that people are finally seeing how powerful it is to be self-aware of our own mind and bodies and go inside to make the changes. So prevention, the timing is now. So thank you.
Perfect. Thank you, Sandy, and thanks for all you do. Bill Reddy, please unmute.
Hi there, I'm with the Integrative Health Policy Consortium, and do you guys work at all with DPC, with direct patient care? Because I think it's a great model and it could be very valuable.
Does anybody want to answer? Yes, Rich?
Yeah, I think your point is very well taken. From the very beginning, we've had discussions how to, if you will, add on to content distribution networks of many different organizations. So we're not there yet, but clearly that is one of the issues that we had spoken about. And the fact that we have such a broad audience today bespeaks of the commitment that Global Wellness has in connecting all of us.
Thank you.
Thank you. Thank you, Bill. Krish?
Happy morning, happy wellness morning to all. Krishna from Vedic Wellness. So we are in the field of wellness education, and I am more interested, like basically how we can, from US, how we can reduce the violence, because in many parts of the world, there is a lot of violence nowadays, and probably mental wellness is another area causing that. I want to see more ideas how we can reduce the violence and improve the mental health. We are working on that area more focusedly, so improving the education in the people. So I'm looking for more ideas in that. So
okay, thank you so much. That's very interesting. That's not something we talk about a lot, but it's obviously very, very important. Jessica Jesse, your hand is up.
It is, and I'm going to keep it simple. We are what we think. So that is the concept of the Buddha. And I agree that, what we put in our minds, in our mental health, and how we approach everything, if we were truly, like Fountain Life said, CEOs of our wellness, we wouldn't, I believe, have the problems that we have currently. So we need to put our CEO thinking cap into our mental well-being, thus affecting, everything else. Thank you.
Thank you, Jessica. And we're going to come back to you to help us do that, because I know you do that in your work, and to great success. Sarah Jones.
Hi, good morning. Sarah Jones, Spa and Wellness Mexico Bay Magazine. I think now, obviously, we know wellness is more important than ever before, and huge amounts of the population want to focus on wellness. But I think that we still have a big problem with motivation and mindset, and getting people to believe that they can make changes, because there are huge parts of the population in Western countries of people that still want to sit on the couch more than they want to move. And for example, in Mexico, still want to choose Coca-Cola over drinking water, and getting people to be motivated to make little health changes in the right direction is still a huge challenge, talking to the people who aren't looking at wellness and what we're doing.
So small steps that people can take, that people can achieve. I think that's a very important thing, because sometimes it feels overwhelming, but if you break it up into small bites, it's usually much more accessible to people. Avani, you're muted still. Avani, you're muted.
Hello.
Okay.
So I come from the built environment, and I'm going to just add a comment to the thinking cap that when you're in the built environment, you can assume that a lot of your behaviors are spontaneous, and how we can create conditions or that allow us to just spontaneously, that prompt actions which are healthy in that sense. So while a lot of our conversation is about taking care into our own hands and being, the CEOs of our own health, there's also the counterpart to that as to how you make that really easy by using the conditions that we have, which just allow people to behave and to create behavior change in a very gentle, in a very soft, roundabout way. It's not through education, it's not through training, it's not through the usual means through which we deliberately convey information, but it's more using some of the arts and the softer
So a more subtle approach, so that it gently nudges people towards what they should be doing.
Right. And I wouldn't use, nudge has been overused, and, you really want people to make more
to embrace this.
Yes.
Thank you so much, Ivani. Christine Clinton, AKA Mrs. Claus.
Good morning, everybody, and happy holidays to all. I wanted to just talk about the children's moonshot too.
Yes, thank you, Christine.
Very important that we remember, since we're talking about prevention, that we start with the little ones. And I would just like to mention, and I have a short time, but that we are going to host in Ireland the Wellness for Children, and we'll host in Ireland the first Children's Mental Health Symposium. And we would love to invite whoever is interested in children's well-being, their mental health, and their overall well-being to participate or to reach out to me. And my details are on there, and I'm sure you'll be able to find me, but we'd love to have further discussions about how we can support children physically and mentally.
We will certainly send, Christine leads the Wellness for Children initiative at the Institute, and we will certainly send links to all of that in the follow-up as well, because that's an incredible, and thank you for mentioning the children's moonshot, which, starting with children is always a good idea. So thank you, Christine. Gori, our wonderful professor from the Savannah College of Art and Design with Wellness Shark Tank of Wellness winners every year. Gori, go ahead.
Thank you, Nancy. So nice to see all of you. I just wanted to share, I love the work Christine is doing. And just to piggyback on that, I think if we could integrate the awareness and exposure to wellness early on is definitely a good idea. I'm working on a curriculum which can be shared with educators all the way from kinder to college, because I do that in my academic practice as well as with the company that I run, and just develop training and workshops and small little things in the classroom. And if they become aware, they become ambassadors, and they take that home with them to their families. So bringing that awareness to wellness early on in an existing system like an education system would be a great idea.
That's a great idea. It's a great idea, and there are so many. Everybody's paying attention. There are educators on this call that would really contribute mightily to moving this forward. Dan Isaacson, you had your hand up.
Yes, thank you very much. Really exciting to be on this call. A couple things come to mind. From Los Angeles. Did a project last year with the Rec and Park Group and with the city of LA. And it was called Listening to Our Kids, really. And we did a whole format with teaching them. We turned the park into a movie studio. And we can get our message out if we start to use our park and recreation areas and teach our kids how to use their cell phone in a minute. You can tell everything about yourself. A lot of subject matters that we can do. And I'd love to explore this with you more, because it was quite successful. Danny Trejo, the actor, came out, talked to the kids. It was a very poor area of town, underserved, but these kids were great. And they had great questions, and LAPD showed up. We had Olympic champions there. So we can use our park and recreations more. And back to Carolyn's comment, we need to listen to our kids, and we do that through our technology today.
Dan, thank you so much. And that is such a wonderful idea. And we talk a lot about nature and parks and public spaces being a really integral part of the wellness conversation. So that's a wonderful way to bring it in here. And we will be in touch with you, you can be sure.
All right, thank you.
Thank you, Dan. Okay, we have time for two more. And we've got two more. So Meng Meng Wang, you are up. If you would unmute, there you go.
Yes. Hi, everybody. Meng Meng Wang from Boston, Massachusetts, and I work in the area of skincare, pharmaceutical company, and education. My question is, if we look at the humankind history, a lot of the diseases that we have now is because of the whole society is being industrialized. The example is the fast food like Dunkin' Donuts, McDonald's, and also the drinks like Coca-Cola that's mentioned before. So my question is, this is such a wonderful effort that all you here collectively is doing. I'm wondering if there is any effort in working with the decision maker in the country or in the world about how to change the industry, like the fast food, like the
Sure. Yes, I mean, yes. So nutrition, healthy eating, that is a huge part of this. And that is something certainly that can be reflected in the Moonshot and the education, and also the giving people the impetus and incentive to make change. Those are really good ones. We have talked about that. We've looked at it. We've done some work in that area, but we will definitely be making that part of it. Smith Johnston, our friend from Axiom Space.
Hello. It's so good to be here and to listen to everyone. And I would just remind everyone we're going back to the moon. Artemis just circled the moon. We're going to have people on the moon in a couple of years, maybe 3 years, 2 to 3 years. But I would say that using all your examples, and especially the folks at Life, I'm trying to incorporate not only with private space industry, but I was at NASA for 25 years, to also use the same tools that we're screening our folks, taking healthy people and trying to find things early and be able to implement programs to help their longevity and wellness and well-being, that we can use those same plans for helping our astronauts get to the moon and stay on the moon, and the risk analysis that we could all bring to this. So, and that can also inspire our kids and our patients. So I think working in parallel with NASA and commercial space companies would be what we need from you guys and gals. So I just throw that out there. Thank you.
Thank you so much. What an incredible thing. Sean, what do you think? Fountain Life going to open on the moon, perhaps?
Well, I think, Smith, we're supporting some synergy conversations in the private travel industry, and we all are, but there's no bigger fan of Smith Johnson's than Dr. Capps. So certainly, if we could do it together, we'll do it.
That's wonderful. And, I just want to say thank you to everybody. This has been an incredible conversation. Don't go anywhere because we're going to be dancing. I want to give Rich Carmona a last word before we turn it over to Jesse and Lisa Fazzulo.
Thank you, Nancy. And again, thank you for all of our colleagues online all over the world. This is really quite inspirational that from nothing, we've brought together a global movement that has the same value proposition of improving the lives of so many. What I'm hearing, lots of great ideas. Some of them we've discussed before, some of them we haven't. Building a foundation still. I will point out to you that almost every one of these things that we're talking about as it relates to changing, effecting sustainable behavioral change are really epigenetic inputs. What are we doing that's causing gene expression to change that makes you a better person, whatever that expression may be, whether it's a lab test or whether it's some physical activity. Last thing I'll mention that we didn't spend a lot of time on, the built environment is extraordinarily important as it relates to pursuing optimizing health and wellness. And if any of you are interested, through IWBI, one of our other partners, the International Well Building Institute, is looking at that very issue. How do we build things in the future that optimize health and wellness, reduce cost of care, and improve quality and quantity of life? Thanks, Nancy.
Thank you, Rich. Thank you, Susie. Thank you, everybody who's on this call. Back to you, Jesse, and let's dance it out.
For the last few minutes, please join Lisa Fasulu, who gets us all up and moving in the Moonshot in Motion part of each call. Today we'll be dancing to the well-loved song Moon Dance. Big thank you once again to everyone for your part in helping us to put the Moonshot into even more motion this past year. And again, we're excited for next year. Happy holidays. Take it away, Lisa.
Great. Hi, everyone. Before you start the music, Jesse, let me, I get so much out of these calls, and it has really expanded my teaching with others in seeing how wellness, at least to me, is taking those universal qualities that live in each of us and amping them up, stirring them up, using different practices that bring those out. And I've been in such a fun mood just with the word thank you and appreciation over the last month and over the last few days. Wanted to use our bodies today to learn to expand that. So real quick example, my daughter's taking psychology. She's in high school. She loves it. She tells me about it every morning. And a few weeks ago, she came up to me and she said, Mom, how do you think is the best way to say thank you to a teacher? So I had learned this from my dad years ago. So I said, well, you could say thank you. This is what I've learned.
Lisa, excuse me. I wouldn't be the producer I am without letting you know there's 2 minutes left of this call and you got to get people dancing.
Okay, let's get up then. And I will talk a little bit while we do that. Go ahead, Jess. Let's stand up.
With the stars up above in your eyes. Fantabulous night to make romance neat.
Okay, and what we're going to do today is spell out, act out with our movement, Global Wellness Institute. So what's global to you? What does that look like in a movement? Global, all of us. Now, what about wellness? What is the wellness that we learn here? And what about institute? Institute really means to bring it in, bring it down, all that learning. And let's end it with the moonshot. Full moon going up. All the words we heard about it today. And here's to 223. Thank you, Nancy. Thank you, Susie. Thank you, Jesse.
And every time you just travel inside.
Thank you, Lisa, and thank you all. Thank you, Sean and Evan, Rich, Jessica, everybody. Thank you, thank you, thank you. Happy holidays.
Happy holidays. Merry Christmas. Happy Hanukkah. Happy Hanukkah.
Bye, everyone.
Bye. Thank you.
Ho, ho, ho. Happy holidays.
Happy holidays.
Happy holidays.
Happy holidays.
Goodbye, everyone.
Goodbye.
Yeah, thank you, man of Malbert. Malbert. The Moonshot Project wants to put a mind on every man and woman to enrich your cranium.
Bye, everyone. I'm ending the call now.
Bye.